Hi, this is Kirk, the Bariatric Carnivore. Well, I got my annual lab work back and I feel pretty darn good about it, so I wanted to share those results with you. The big things that I keep checking on a regular basis is number one, A1C. A1C level is a 3-month indicator of how good you're doing as far as your blood sugar control is. A red blood cell lives for about 3 months. Sugar attaches to it. It's called through a process called glycation, and you can tell what's the average blood sugar of somebody by looking at that number, and you really want it 5.7 or below, according to Dr. Barry and other folks that have studied this stuff, and Dr. Ben Bickman, who's one of the best researchers in this subject. So having a relatively low A1C, 5.7 or below, mine's at 5.6, is a pretty good indicator that you're not type 2 diabetic, and you're doing a good job as far as the overall glucose is concerned. My fasted glucose level was in the 80s, which is always fine. I mean, that's as long as it's not over 100, I'm pretty happy, and having it in the 80s is pretty darn solid number. And then I do basic blood test for thyroid health, liver health, kidney function. Now these, they're not the be all and end all. So I don't have any symptoms of any diseases, but it's nice to take a look under the hood at least once a year on these key indicators to make sure that there's nothing that's not non-symptomatic from my perspective right now. So having a look at these numbers, that everything is functioning the way it's supposed to as far as how it shows up in the blood is fine. I mean, things could happen, but frankly, checking those numbers once a year when you don't have symptoms makes, I think a small amount of sense. It's small insurance to make sure nothing's wrong. If you want to learn more about what type of labs to do and what all those things make sense of all these different numbers, get Dr. Ken Berry's book, Common Sense Labs. Very, very helpful book. It'll tell you what test you want to be looking at, and also what those numbers mean and what the ranges mean, and that's important. I frankly, for years, would get these blood results. I would look at it, and unless it was written in red, I didn't care about it because I didn't understand them. So when you get this type of book, and very easy to understand language, I mean, it's written probably close to a 6th, 8th grade level that most of us can just read, understand, and just make sense of these labs. You're paying good money for this type of information. So hopefully, it will be useful to you. Now, let's get to the $1 million question, or should I say the $1 trillion question, and that is about the cholesterol. And frankly, when I look at the LDL cholesterol, the so-called bad cholesterol, I don't care. I frankly do not care about that number one way or the other. And you know why? Because that was the result that I took away from the UCLA study, where they looked at people that had heart attacks and they checked their blood cholesterol levels. And the results were absolutely fascinating, because about a third had high, a third had normal, and a third had low, which kind of tells me very clearly that who cares about cholesterol levels? When you look at what the risk factors are for heart attacks, it comes down to number one, with a bullet. The most dangerous thing you can be is a type 2 diabetic. High blood sugar, high inflammatory stuff, that's the stuff that I'm worried about. But total cholesterol and the HDL cholesterol, frankly, is not indicative of cardiac health. Matter of fact, there's other studies that show that actually having a high total cholesterol level is actually rather protective. People live longer when they have a high total cholesterol. Why? Because part of your immune system is relying on your cholesterol levels, believe it or not. And people forget that it's there for a reason. Your body creates the bulk of the cholesterol in your system. It's not coming from your dietary fat. It's actually coming because your liver makes it. It needs it. And I don't want to be lowering that number artificially unless there's a darn good reason for it. And I can't find a darn good reason to make that happen. So I don't take a statin, and I don't try to artificially lower my HDL. Now, What numbers in the lipid panel do I care about? And that's an interesting question, because there's several different types of cholesterols or lipid proteins that are going to show up in your test. You've got your HDL, the LDL, the so-called bad cholesterol, and triglycerides. Now, the triglycerides are kind of a measure of how much carbohydrates you're eating, and a great proxy marker for how insulin resistant you are. I mean, the best test is probably your fasting insulin level, but I didn't get it done this time, and I'll tell you why later. But what I wanted to look at was the ratio of triglycerides over HDL, so-called good cholesterol. And you want that number to be as close to 1 as you possibly can. You want your triglycerides to be about as equal, almost equal to your HDL cholesterol. Because that is an indicator. I mean, if there's ever an indicator on that lipid panel that you really need to pay attention to, that's it. And frankly, I know that because my triglycerides used to be sky high, and my HDL, the good cholesterol, was always very low. And for the first time in my adult life, we've actually had a shift. My triglyceride HDL ratio is actually below 1 for the first time. That's right, my triglycerides were lower than my HDL cholesterol, which is fantastic. I mean, that's exactly where I want to be. That is where the most heart healthy place you're going to be. And frankly, cardiac disease is the #1 killer. So I want to keep that stuff low. I mean, I want to keep my heart attack risk low. And one of the best indicators is overall blood sugar and A1C and HDL triglyceride ratio. And I really do wish more doctors and lab companies would put that information in there front and center, because that is one of those important issues that you're going to run across. So I don't pay any attention to the $1 trillion statin industry that is out there trying to artificially lower my cholesterol. Don't care. I don't think there's any reason for it. And this is your choice. See, there's a couple of different models for how you want to look at your overall lipid panel. Now, there's no disease that's called high cholesterol, believe it or not. The only reason they're concerned about it is because they think there's a thing called a lipid heart hypothesis that says cholesterol in the blood is going to cause a heart attack. And the reason why I say that is when they looked at clots that broke and were in the heart, they had cholesterol in them. Well, where do these plaques that jam into the heart and clog the arteries and cause strokes and heart attacks come from? Well, they come from plaques in your arteries. What happens? How do you get the plaque? How do you get, what causes them? Well, it's strain on the epithelium level of your arteries, and it creates cracks in there, and the body seals it creating these plaques. Those are healing. And part of the stuff that's in that healing goop on top of it is LDL cholesterol. It's part of your healing system. The problem is when those plaques break, they're almost like a pimple, and if they break in the inside of your artery wall and it gets in there and it gets lodged in an artery in your heart, you have a heart attack. And if it lodges in an artery in your brain, you have a stroke. The two biggest killers that we've got. But the problem is, I think a lot of doctors confuse the cholesterol of being arsonists when really, in fact, they're firemen. See, if an alien race came to the earth and looked at fires, and every time they saw fire, they saw fire trucks and firefighters, they would assume that firefighters and fire trucks were responsible for the fires, not the arsonists. And I think that's kind of the problem that most people have with cholesterol. We see cholesterol being part of these plaques. We see them breaking off, causing heart attacks and strokes. But were they the arsonist or were they the firefighter? And frankly, I think they were the firefighters. We just blamed them when we should be blaming what caused the plaque, which is the inflammation the high sugar levels. That's the dangerous part as far as I'm concerned. That's what I'm betting my life on. That's what I'm working toward, because I think that's where the research points. You're an adult, you can make up your own mind. That's just where I think the evidence goes. And it's not to be smug, it's not to be contrarian, it's just I look at the preponderance of the evidence. There's not really any great studies that say 100% this diet is going to make you live longer. This diet's going to make you live healthier. But when you look at the preponderance of the evidence and what is going to result in your least amount of greatest chance, and frankly, type 2 diabetes is what is going to increase your heart attack risk more than anything else, by far. So the best way to avoid that, eating a low carb diet. That's why I'm eating carnivore. That puts my chances of becoming a type 2 diabetic down, way down, because I eat very few carbs. So this is Kirk, the Bariatric Carnivore. If you like this message, if you agree, please leave comments down below. Share your numbers with other people. If you're a carnivore and your numbers are low, share them. If you're vegan, share yours. I'm curious about this because your body's going to produce cholesterol, whether you're vegan or you're a meat eater. Saturated fat that you take in your diet doesn't seem to affect that level very much at all. And frankly, I'm not artificially lowering my LDL cholesterol by utilizing statins. I think it's $1 trillion waste of money as far as I'm concerned. But that's me. If you like this message, please hit the like and subscribe button. I try to put out a message a couple times a week. I will talk to you soon.